If you are immunocompromised, if you have chronic medical conditions, if you are over the age of 60, you are at higher risk. If you are a child or a young adult, you are less likely to be impacted by the coronavirus.
If you have young children, they are less likely to get coronavirus than you. Did you know that? Why? And could that change? I want to welcome Dr. Eddie Fatikoff. He is a board-certified internist and nutritionist. Every parent I know is talking about this. Okay, well, we know our children are not going to be affected as much. Why is that?
That's a great question. They did a study when they looked at Johns Hopkins researchers and over the data in China, and they saw that in large amount, most of the people that were affected were adults. Most of the children were spared, and the ones that were affected were asymptomatic in most cases, probably had a cough, but nothing severe or serious. And then the question becomes the immune system. How is this different from adults, and how is this different from children? Because as you get older, your immune system gets weaker, and as you're younger, your immune system starts to build, like you would have with the H1N1, with the flu, where it would affect kids just as bad as it would adults.
Yeah.
Okay, and what they're starting to look at is the $64,000 question: is that kids who get the human coronavirus more likely than adults, the common cold, do they have some cross-reactivity? Do they have some antibody protection like a vaccine would against the new novel COVID-19 virus?
Is this a virus that could mutate and that might change?
Correct. It could just be like the flu, where next year it's a mutation, and we have to kind of adjust the vaccine for next year's case.
You know, the vaccine we've heard for coronavirus, still a year out. So when you say that children could be asymptomatic, I'm then thinking, well, what if they're around our grandparents that are immunocompromised? I mean, could that be a risk? And should we be thinking about that if our kids just have a little cold?
Yeah, especially there's a lot of cases that are undiagnosed and asymptomatic, because look what happened. Back in December, this outbreak happened. People came in the United States December and January before we closed the borders, right? So there's a lot of people walking around, they're asymptomatic, that are transmitting it with no symptoms at all. So there's a lot more people that probably have it. And the concern that I have is, and why the schools are shut down all over the United States, is what if that child who's asymptomatic comes in with a cough, plays with his mom or dad, and they're diabetic or on dialysis or have heart failure. Now that person is sick and potentially die, and who's going to take care of that child? That's the concern. That's a safety concern for our elderly population.
So do we need to be shutting down schools the way we've been seeing it?
I think that the virus is seasonal, just kind of like the flu is. Now, are there cases of the flu in the summertime? Sure. I see patients that get the flu in June and July, but the study just came out yesterday, the researching colder weather transmit the infection higher. So once the warm weather, it's hard to say, once the warm weather gets better, I think there'll be less cases. I think it's okay to temporarily shut down the schools, sanitize it, and create safety precautions.
I have a child with asthma. I know a lot of my friends that have kids with asthma. Are they at more of a risk, and in what way?
They are more of a risk, and what's notable was it's more of a risk, but not as severe as the adults. And what is happening from the study that they showed was adults' immune system, kind of like the SARS, you get that first week infection, it goes away, then that second infection is what kills you. It's because the inflammation gets so ramped up that your body inflammation cascade causes the lung damage and causes you to have that symptom. You don't get that in children, right? And that's what makes you unique, and that's what we can't figure out why children don't get that. Probably because children, 5-year-olds and 3-year-olds aren't smoking cigarettes, right?
And you pointed out, look at Italy, look at China, where there is a huge population of smokers, and that's been a lot of the deaths that they've seen. Yeah, and factory workers, and they're mostly men, they're in their 50s, and that's kind of the missed piece. Our genetics and our way of life is different than in China, is different than that of Italy. So I think we're better equipped to handle the coronavirus, and our patient population is. It is such incredible information and helpful. I know so many of you have a lot of questions out there. Thank you, Dr. Fatikoff, also the author of the book, Dr. Fatoff, Simple Lifelong Weight Loss Solutions. Thanks for being here. We appreciate it.